A very good evening to all of you. This is Dr. Vivek Goel, your nephrology faculty, and we have amongst us Dr. Beauty Suman Singh, who has scored a very good marks of 297 in the NEET SS nephrology entrance exam, and she has scored a rank of 22. So first of all, a very, very big congratulations to Dr. Beauty Suman Singh.
Thank you, sir. Thank you so much.
Great. So first things first, Dr. Beauty, can you just take us through that 30 seconds when you first saw your result? What did you exactly feel and how did it happen?
Actually, sir, when I checked it, now I again checked it. I was like 297 score, so and then I checked what is the highest score, and where I am falling. Then it was like 22, so it was really good. It made me feel very good, and I rechecked it and checked it with my friends also. They also checked this rank. I confirmed it that's 22 only. So it was very good.
So what was the reaction of your family, your parents, your partner?
They are
How did
very
they feel?
happy. Actually, they also wanted me to perform good. They are very happy. They are feeling proud of me.
Great, great. So for all the viewers who don't know, till now the NEET SS has not given the exact ranks. They have just given the roll numbers and the respective marks which every student has scored. So by retrospective analysis, we ourselves have calculated what our ranks would be. So that is why Dr. Suman has a rank of 22, which is our presumption, of course, on the basis of marks.
Yes.
So that's a very big achievement, Suman. So just introduce yourself. Just tell to the audience, where are you from? Did your grads and postgrads from?
Yes, sir. Myself, Dr. Beauty Suman. I am properly from Uttar Pradesh, Varanasi, and I have done MBBS from GMC Aurangabad, Maharashtra, and then MD Medicine from TNMC BYL Nair Hospital, Mumbai. And this was my first attempt. I have completed MD Medicine in September 2021. Then I had given this NESS, and then now this was my first attempt.
Superb. So to all the viewers, this was a very first attempt, and in the very same year that she cleared her MD and her postgrad, she has already cracked the super specialty entrance exam. So I always tell to all my students that first attempt is the best attempt, and Dr. Beauty has absolutely proven me right. Superb. So did you have any experience of working in nephrology, or did?
Yes, sir. Actually, sir, after first year residency, we have super specialty posting in our hospital. And actually, our hospital's super specialty, this nephrology department is very good. And in that also, during that posting also, I got that inclination of doing this nephrology. When we used to have this peripheral posting and alternative day calls. So we used to have so many patients and we used to see, and it is more like internal medicine only with a specialization. So it was the inclination that started from the second year super
So
specialty.
that brings me to my next question, and very important question: why nephrology? Why have you chosen nephrology, and why not other subjects like cardiology, neurology, hepatology, etc.?
Sir, actually, sir, nephrology is the kind of subject it is linked to every branch. It is, it means you will be in the touch of every branch, whether it is infection, rheumatology, or cardiology. Even in the ICU setting, also means nephrology has contribution in everything. I will be always in contact with this medicine part, and medicine is the first means priority. Medicine is the main thing.
So that again is a very big similarity between Dr. Suman, me, and most other nephrologists. That nephrologists are primarily internists at heart. They love internal medicine, and actually they want to pursue super specialty, but they don't want to go away from medicine. And that is why when you do nephrology, you see all kinds of patients. In fact, you will come to realize that when you were talking about infectious disease, the amount of patients I did not see of infectious disease during my MD days, I have seen more of them during my nephrology residency. So that is the beauty of nephrology. So that is absolutely correct what you have told me. Now take us through your mental strategy, your journey during your residency days. How did you plan your residency? What did you do for all the young residents, young medicine and DNB residents who are watching you? Not only cracking the NEET SS, how did you pursue your residency? So what would you like to tell our young viewers?
Actually, during the MD residency, we should focus on the practical thing, what we see in the patient in the ward. We should spend more time with patient because those are the things where we learn actually. And apart from this, along with it, that Harrison based, this is very important. Study is very, very important. And during MD residency, I only used to study Harrison only, no super specialty book. after completing my this MD medicine only, I started this reading Fihali. And initial days, it's MD medicine for this Harrison should be thorough. Means it is the book, it's very essential book. It helps us to correlate with what we are seeing in the patient. Means it's very practical. That is very important, because only practical is not sufficient and only theory is also not sufficient. We should have to this should be combined together to improve ourselves, to improve our diagnosis, making how to approach it.
So what is your message to those young residents who feel that, right from the very first year, they kind of do away with their duties, they don't go to wards very often, and they start mugging up books, just like, and they think that once we crack the NEET SS, then we will work. Just like, during our MBBS days, we were told by our seniors that during internship, you should work. But
Yes.
as I became a medicine resident, I saw my junior interns, they were just, they were sitting with their MCQ books in the OTs and in the emergency wards. So what is your message? Is that sufficient to become a good nephrologist?
No, it's not like that. It's absolutely not like that. MD medicine is a different aspect. It's an essential part. And in that, in 3-year residency teaches a lot. And in that, the participation of the patient and what patient teaches is more important than even the theory part. Theory, we are going to read whole life. But what patients are teaching, what we are learning there now, we are not going to learn later. We will avoid it. We'll keep on avoiding it. We'll never learn this thing. And this residency part, it has academic part also, clinical part also. There we have clinical session with interaction with patients and how teachers used to teach us. This is a very important thing. No one is going to teach us later all these things. We should give full concentration, full time to our residency, and to that only. Super specialty can be done later, and it's not like you can do that after 6 months or a 1 year. It's not like that. But MD medicine, for that 3 years, is very essential. You should be in the touch of the patients only. We should not waste time. It's like in just reading books. We are not going to gain anything but just by reading books only. This is a fact only. And I don't think any medicine residents, when doing the residency, they can't avoid this patient and this doctor's relationship. That is very good. And it is going to teach us a lot. Means practical things and how to approach various systems. That is very important. Ward rounds and then clinicals, these all are important.
So, I always tell my students that it's a very famous saying, what your mind does not know, your eyes cannot see.
Yes.
That is, of course, there. But I believe in the opposite more than this. What your eyes have not seen, your mind does not register. So, if you go on mugging up about a disease, I'm pretty sure you will forget in 10, 15, 20, 30 days. But once you see a patient of that disease, you will never forget the points about that disease.
Yes, sir.
So once you see, because, till now, I get recalls of my first year MD medicine residency days, that I remember that in that corner of that ward, on this chota wala bed, there was a patient sitting with a lungi and he had amyloidosis. Do you get such recalls, Dr. Suman?
Yes, sir. Same thing happened. We used to recall that patient, how they had presented and how we had diagnosed. We went to the diagnosis, how we approached it. We used to remember that we have it registered in our mind. And that is very important. Because, and one more thing is important. We'll never learn how to make a doctor-patient relationship. That should be very good through just by reading the books. That is only practically when you'll see the patient, and that time only you'll understand it.
So that is a very, very important thing that Dr. Suman has stressed upon for all the young viewers. What she has stressed upon is a doctor-patient relationship. It's a very sacred relationship. And you don't learn how to interact with a patient until you do it. You don't learn how to counsel a patient, how to tell a patient about a bad prognosis of a bad disease until you have done it n number of times. So, that is only gained through experience. And Dr. Suman has told you very, very valid and important points. So for all the young viewers, the young medicine residents, you must actually follow what Dr. Suman has said. So Dr. Suman, you have cleared the NEET super specialty entrance exam. Just take the young viewers through the pattern of the exam, the marking scheme. Yeah, just tell us, what was the exam like?
This time exam was like 60-40 pattern, 60% from the super specialty and 40% from the medicine. So this time medicine part was like more of neurology question, but that was more practical based question. Clinical scenario was there, and it was very easy to rule out the two option, but two option a little bit confusing. But it was more neurology. If someone has read Harrison, one can easily attempt, except few 10 or 15 question. But it was a difficult one. While the nephrology part was like average. Out of 60 question, I can say everyone would have done correct 50 question, and 10 question were like a little bit on tougher side, but that would also like not very tough. We can easily, if we have learned carefully, we can easily rule out the option. So
So
it
Dr.
was
Suman is
nephrology.
being quite generous. Not everybody could have marked 50 out of 60. She has done it because she is brilliant, of course. Not everyone can do it. But yeah, you need to work hard towards it. Definitely, definitely. And what was the marking scheme like? Negative marking and
That was 4 marks and -1 this for negative.
okay. And how much did you attempt?
Sir, I had attempted 98 questions.
So out of 100, she attempted 98 questions, and she landed up with the marks of 297. So did you calculate how many did you get right? Almost.
Sir, around, sir, I made mistake of 14 or 15 negative.
So you almost had 80, more than 80% correct responses. Okay. And how much do you recommend should be, because some people fear negative marking. So how
Yes,
much do you recommend that the students or the followers should attempt at least?
actually, if we are confident enough to rule out of 2 option, we should attempt. We should give it a chance. Out of 2, we should attempt it. So that was what I followed. But if you are very confused, it's like question is very unknown. If you don't know anything, do not attempt it. And I think 90 plus should be there, and 95 plus is safer. Sorry.
Yeah, she's absolutely correct. What she has said is that you need to be attempting on the higher side. So to win a match, to win a cricket match which is 50 overs match, you cannot play 30 overs well and leave the last 20 overs. So you need to bat till the 50th over to win the match. That is what she's saying, that even though you have negative marking, you have to take into stride the law of probabilities, and you need to attempt at more than 90. And if you want to be in the top 50, you need to attempt more than 95. And of course, your accuracy must be on the higher level as well.
Yes.
So that is absolutely correct. So did you appear for the INI SS exam, Suman?
Yes, sir. Yes, sir.
And how did you do that exam?
Sir, my rank was 21.
Okay. So Dr. Suman also had a very similar rank in the INI SS as well. So she has been a consistent performer throughout. So INI SS, for all those who don't know, it was the Institute of National Importance exam, which had combined the top central institutes, and it was a two-staged exam. And also the rank 1 was also for our own student. So there is already an interview which we had conducted. If you want to see, you can go and see. So Dr. Suman was a regular subscriber of nephrology at DocTutorials. So she subscribed to both the videos and the entire package, including the test series. So did the videos at all help you, Dr. Suman? And how did DocTutorials play a role in you clearing this exam?
Actually, I took this subscription in the midst of September. At that time, it was like a Harrison-based exam was going to be held. So I just go through all these neurology, endocrinology, all videos I have completed. So that helped me to revise the Harrison's topic. And later on, when I nephrology, I saw all the videos. All videos were like awesome. It was very simplified, and we came to know what are the important topic and where to focus on the Fihali table, which are the important topic, and what questions can be asked and what question has been asked already in previous exam. So that gives us a path, and we come to know which portion we have left, and how much time we can complete it. This time target we can make easily. And also the important thing was this test series that was very 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 useful. Actually, that was a practice test like thing. Every weekly, on every topic there were some 50-60 questions. That was very helpful, and helpful in revising the topic in multiple times. And also a reference was also given, so we used to see it with the this Fihali comprehensive. So that helped me to revise the table multiple times. That helped a lot, and that covered all the previous question as well as the possible future questions. So that was very much helpful, that test series. And that rank scoring, that helps us to keep on going, keep on practicing, keep on improving ourselves, and to know what were that were the missing thing. so that we can do that better next time. That helps a lot.
So what Dr. Suman has said is, small motivation, small incentive can help you win a bigger challenge and a bigger race. So Dr. Suman performed consistently well in all the weekly elite tests, which her ranks speaks about. So all those tests were crafted by me only, and I made it a point that the questions were not typically taken up from an MCQ book, which I have old redundant questions. They were absolutely contemporary questions. All were new questions taken from the most recent references, the latest guidelines, and they were in the context of NEET SS and INISS. A question which is of NEET PG level, a question which is of very high level, which is of the level of a DM candidate, again that would also not be useful. You need to practice questions which can come, and that is why we had such a high strike rate of questions both in the INISS and the NEET SS in the nephrology part. So that is awesome. And so, Dr. Suman, we also have close WhatsApp groups where we give constant motivation, we give solution to the answer. I personally was recording voice messages also
Yes,
for all the students. So did that help you?
sir, actually, I have joined that Zoom meeting just 4 days prior to the exam. That was very much helpful that the previous year question discussion were there, 2020 and 2019. That was actually really helpful. You already had told that 15 question will come. Actually, that helped a lot. And it keeps us going.
So just sum up your strategy, or what strategy would you advocate to the future students to clear the exam, and how should they craft if they want to clear nephrology, their strategy while doing an MD residency or a DMB residency?
I would like to say that we should more concentrate on the MD medicine, that is residency in that on the patient and the Harrison based this study. And when you get an inclination, you get to know that you are interested in the nephrology part. Mostly, most people get it in second years. The super specialty posting. I think we should start reading topic wise from the super specialty book if exam is going to conduct it in that sense. Otherwise, we should read Harrison. Harrison itself is a very much vast thing. So we should read it and we should try to correlate with it in patient also. Whatever we are reading, we should try to see that in patients. Means try to correlate and concentrate on being a good practitioner, good physician. Then that is very important thing for being a nephrologist or any super specialty. Firstly, you are going to be a good physician, then only you can be any specialty where you're going to face all those complications. Those complications are managed by this MD medicine people only. We are the only people. We should be keep this in mind that we have to be first a good physician, then super specialty. And as the pattern changes, we have to change our mind setup. And these sir also used to guide us how to approach and how to move forward, how to take the exam. Means if the pattern is going to change, it is going to be mostly Harrison based, then we have to concentrate. That's a very good thing. Then we have to concentrate on the Harrison only, read it multiple times from second year itself. We should start reading it seriously. And I think in till third year, it helps in our this theory exam, practical exams also, as well as in MCQs also. Practice is important, and for that we can do it from our test.
So when will you recommend your juniors, your the viewers who are listening, what is the ideal time for them to subscribe to this DocTutorials package?
I would say it will be very helpful if one can join in second year residency, because at that time during the super specialty posting, along with that posting, they can see the that particular disease, that topic from this videos, and that are very well simplified. You don't have to just give your mind full. That is very easily made that you can understand, anyone can understand, and that you have to correlate with patient in the ward. That is the only thing. I think second year is the best time we should start, so
So
that till
that
the third year we can do multiple revision.
exactly. So if you subscribe the course in the second year, you can make notes out of it. As Dr. Suman has repeatedly said, I have made the course very elaborate in depth and in breadth, yet very algorithmic in approach. So that is why there's a difference between seeing the videos of mine and making the notes and studying a textbook. Because everything I've tried to curate in the form of a flow chart. I have given the latest KDIGO guidelines, because most of the MCQ books and even Fihali for that matter has outdated guidelines, because of course it was published earlier. And the KDQ guidelines and the other guidelines also, they keep updating regularly. So you need to be very, very up to date with regard to that. But of course, as aspirants, we don't have that much of time to go to so many sources and make everything concise. So concise knowledge and smart knowledge is the key to cracking any entrance exam, and that is what Dr. Suman has done herself, and that is what she's recommending to her viewers as well. So, Dr. Suman, now you have got a rank of 22 in nephrology. What is your plan? Everybody wants to know that.
Sir, I would mostly join in the college in Delhi if I could get, if I could get DM nephrology in Delhi.
In
And there
Delhi, what college are you aiming for? In Delhi, there's only one college that has DM,
RML,
RML.
or otherwise, if it is if I don't get this RML, then I will go for the Gangaram or Medantas.
Okay, so you're not eyeing for other institutes.
No, I would go for Delhi only. Means in Delhi, that my priority is like this.
So is it because they are very good, or is it because of a personal reason?
Actually, personally, my home is in Mama. My mother, father is there only. So it is nearer to that hospital. That's why.
Okay, that is superb.
These are good hospitals also, and no bond is there. So that is the plus point.
Yeah, that is a very, very plus point. Yeah, that has to be good. I am also working in one of those. So that is very good. So last parting words, Dr. Suman, any message you want to give? Any message to the DocTutorials team who have worked so hard for you all?
Yes. Thank you so much. Thank you so much to the whole DocTutorial team, Rahul sir, Vivek sir, आपको भी thank you so much for making me easy to crack this exam in the first attempt. Otherwise, it would have been difficult, quite difficult. So thank you so much, sir. I was able to crack this because of you people, and this team is awesome. This awesome, and I took all the benefit that I can get from it.
Superb,
That
superb.
helped
No,
me.
it is absolutely
Thank
your
you
own
so
hard
much.
work. It is your own hard work which has we have all only helped you, and that is our task. So all the very best, and
Thank you.
may you become the best nephrologist. Hope to keep in touch with you at nephrology conferences and nephrology webinars, and all the very best. Keep spreading the love of nephrology, and take care. Bye bye.
Thank you, sir. Thank you, sir.